It's treating me good. I've been in Fort Lauderdale for years now, but I've originally come from Miami, Florida.
Okay. Tell me what's going on with your child.
Okay. I have two children that have been diagnosed with ADHD, and right
What
now,
grade are they in?
one is in fifth, and the other one is a senior.
Okay.
And right
How
now,
old were they when they got diagnosed with ADHD?
my daughter recently got diagnosed with ADHD, like earlier. I just try to, just manage it on my own. But then it got so bad till I had to go to, get the observation at the school and, go through the whole processes. And then, I had to put her on medication, which I really don't want to. But, and the same thing with my son. He got diagnosed with ADHD like 2 years ago. And right now, I'm having a really hard time getting help from the school because my children are struggling. And it's not enough. It's not, I would say, in my opinion, it's not proper help for children who suffer from ADHD in our school systems.
Okay, so your daughter is the fifth grader.
Yes.
And your senior is male or female?
Male.
Okay. When did he get diagnosed with ADHD? What grade was he in?
He was in elementary. I don't remember what grade he was in, but he was in elementary when he was diagnosed with ADHD. And he's been struggling in school really because of that. My children are very smart, but they just struggle really bad because of it.
Okay. Now, if we start with the senior, just so you know, psychological evaluations are normally not very valid beyond 3 years. So if he was diagnosed in elementary school, he's now a senior. I couldn't put much weight on that diagnosis because it was so long ago. Additionally to that, you probably already know I'm not a fan of ADHD. I think it's a scam, to make billions of dollars off of children who are not being taught discipline or who have other issues that are not being addressed and is simply being blamed on ADHD. I think it's a distraction. But with that being said, with him being a senior in high school, first of all, he's never repeated.
No, he's never repeated, but it caused so much of me. It's really not even normal. How much of me how much of me I had to give, and I'm not even talking about normal, like a normal parent, how they should give themselves to their children, their education and stuff. I'm not even talking about the normal amount. I'm talking about a really abnormal amount. And my children are like, I'm not one of those parents who have bad children, and I'm in denial. My children are in the home, and they are good children. So, I'm not even too sure, what's happening right now. But when the doctor told me, it was ADHD, and that was because the teachers have to do an observation and answer questions on a paper just by observing the children in class. So I'm not too sure what's going on, but I just need the school's help because I have to really, really stay on top of them in their education in an abnormal way.
So going back to your senior, he'll be graduating in about 5 or 6 months. My question, I need a little clarity, because if he's never repeated and he's graduating in 5 months, is your concern about his academics, or is your concern about his behavior? And with so little time left before he graduates, and then I'm wondering, are you claiming that he's been socially promoted, or is he on grade level? Like, where is the academic concern? Because see, here's the thing. Well, first of all, let me say this. Looking to the school for help is often a recipe for disaster because they don't give much of that. So I still don't know why we're getting children evaluated for ADHD. It completely baffles me. But with that being said, help me understand, with so little time left for 12th grade and the fact he's never been retained, give me some more clarity into your concern with him. Do you feel he's been socially promoted? Is he not on grade level? Because remember,
Yes, he
now,
is
you never
socially
mentioned
promoted.
special ed. You never mentioned that. But if that's the type of help you were looking for, you can't qualify for that even if you have ADHD, unless the ADHD is affecting your learning in the classroom. If there's no impact on educational performance, you cannot legally be given an IEP. So help with your senior. What exactly are we looking for?
So he was just recently given a IEP. Not recently, but he was given a
What grade
IEP.
was he given an IEP in?
11th grade
They gave him an IEP for the first time ever in 11th grade?
for the first time. Yeah.
That makes almost no sense to me. Now, mind you, I'm a certified school psychologist. I've been evaluating kids for 25 years. So I don't understand why a child who's never been retained, who made it to the 11th grade, gets an IEP in 11th grade. If he had a disability, that would have definitely surfaced long before 11th grade. And what is the IEP for? Is it for the ADHD?
Yes, it's for the ADHD.
So they gave him an IEP in 11th grade for an ADHD evaluation that took place in elementary school?
Yes.
That's completely improper. That's completely improper. That's completely improper. Somewhere, somehow, they are guilty of something. You don't give a kid an IEP in the 11th grade for ADHD. Where is the effect of the ADHD on learning? If he's never been retained, I'm not getting this. What kind of grades has he been getting every year?
So what happened is, in the 8th grade, he's supposed to have been retained, but because of the COVID, the pandemic, they just moved everybody up to the 9th. So whether you was failing or not, you were moved up. And the school system down here is, they will pass you. They will just keep passing you, even if you're failing, as long as you don't make I think like straight F's. Even if you don't have the credit, all the credit, they'll pass you.
Okay, let me ask you another question. In order to get an IEP, you must first get an evaluation.
Right.
So even if they go off of that old ADHD diagnosis from elementary school, which is not valid anyway, it's way outdated. But even if they go off of that, the school still has to evaluate your son. So was there an evaluation, and do you have the psychoeducational or special education evaluation report? Not the IEP. I'm not talking about the IEP. I'm talking about the psychological evaluation that must qualify you for the IEP.
Yes, they did that.
And you have it?
Yes, I have it.
And what is the classification? What is the disability classification that they gave him to qualify him for special ed? Is it the ADHD? Did they say learning disability? Did they say intellectual disability, emotional disturbance? What is the disability or disabilities that they gave him?
I have to go get the form. Probably take me a minute or two. But from my understanding, it's a learning disability.
It's a learning disability in the 11th grade. Okay.
Yeah.
If your son, how long has he been in this school district?
He's been in this school district until, I think, because he had went back to Miami for a year. It was actually like first grade. He was down here from first grade all the way up until 6th grade, and then he went to Miami-Dade in 7th grade, and then he came back for 8th grade all the way up to now.
Okay. If your son really has a learning disability, I just simply think he hasn't been taught, nor has he been applying himself. That's normally the case with our black boys. They're not taught, nor do they apply themselves. But if that's the case, that he really has a learning disability that went undetected all this time, first thing I want you to know, if this is true, then they owe you compensatory education damages from the time he started in that school district. So if that was kindergarten or first grade, they literally owe you compensatory education for the past 10 years. Because if the diagnosis is accurate, and I doubt it, but since they gave it to him, you could call an IEP meeting and bring up a conversation, say, you owe me compensatory education services because my son had a learning disability since kindergarten, which again, I don't like children being evaluated that young, but since he has the label, you want to use it to help him. You all owe me, this school district owes my son compensatory education services for the past 10 years that he was allowed to be in class without the proper help and not being properly classified. So they would owe you compensatory education damages for 10 years. So the special ed money that they should have gotten had he been properly evaluated and placed, they owe that to him now for 10 years. So, you know, 10 times about an extra $6,000, $7,000, $8,000 a year. They owe you anywhere from $50,000 to almost $100,000 in comp ed money. That check will not go to you. It goes into an escrow account, and you can bill the school district for services until that money is completely spent up. So just know they owe you comp ed. That's one thing you need to know. You could even potentially argue a private school placement because they failed to identify his learning disability in the until the 11th grade. So they went with 10 years without identifying your son's learning disability. So you could even argue that I don't have faith in the school district. How could y'all let my son go so long without an IEP? And you could argue an approved private school placement. Although I cringe when I say this to you. I absolutely cringe because number one, I don't think he has a learning disability. You know, I've never met him. I've never seen him, but 11th grade for a learning disability, I think they just gave it to you to placate you. Number two, I don't believe in children being evaluated early. I definitely don't believe in them being evaluated, you know, this young. But if he had an IEP since 10th grade, correct?
10th grade, yes.
Okay, so what is his special ed service? Is he getting full-time special ed? Is he in a class all day? Or are they just pulling him out for learning support? What type of special ed service is he getting?
Okay, so I just pulled up his special education services, and it's actually a lot of information, so I'm just kind of like skimming through it. But what I do know is that they give him a little bit of extra time on tests, and they do, like you said, one of the options that you just said, they'll let him leave, I think, around the end of class to go to a support specialist in a room or whatnot. But they have literally slipped up, even like with my daughter. I know we're talking about my son, but even with my daughter, the teachers are not being aware that these children have IEPs and 504s. The teachers are coming into the classroom with these students and not knowing their special education or whatnot. Even with my daughter, when I went and had a meeting, just a regular parent-teacher meeting, because I'm seeing her grades are failing. He said he didn't even know she had a 504. He didn't know. And the same thing with my son, the teachers are not knowing. So this creates the problem, because now the children are failing. They're not getting the extra time. They're not getting the services that they are supposed to get because the teachers aren't aware. So, but with my son, he get extra time, and that's it. They don't offer psychological services. They don't offer counseling or anything. I have to find that outside of school, and that's, you know, below mediocre at best. So, and that's because I can't, I don't, you know, it's not, I don't have any help with the school. I would actually prefer to be the school's counselor, the school's therapist, or whatever.
You don't want the school counseling your child. All they do is break up families. Never let the school counsel your children. Now, maybe your 12th grader, because he might be almost done, but not your 5th grader. Do not let the schools counsel your children. All they do is dig into your business. It's more of an interrogation than therapy. And the next thing you know, you got child services knocking at your door, asking questions. I would never. Okay, I've been working in schools for 25 years. I would never let a school counselor counsel my child, especially a white female. A snow bunny, all she's going to do is dig in your business. And the next thing you know, you got issues and investigations. I'm telling you, I would never do it. Never let a school counselor counsel your child unless you know them personally and they black. But I would never let no white woman counsel my child. All they do is
Right.
investigate family life. That's all they do. Ain't no counseling going on in there. Also, here's the other thing you need to know about your son. Okay, let me say this, and then I'm gonna ask you a question about that report. And let me say this as well, good sister. In all humility, and I'm saying this not just for the benefit of you, but for the parents who are currently watching me on Instagram at Dr. Umar Johnson and on Facebook at Dr. Umar 𝚂𝚂𝚁𝙸𝙱𝚴. There's 5 things you should automatically know about a child with an IEP. This should be memory. You should know it. You should not have to look for it. Number 1, what is my child's disability? You have to know the reason your child is receiving special ed in the first place. It's inconceivable, right, that a lot of our parents don't even know why the child is in special ed, especially when you had to sign your name 4 times for them to get in special ed. So you got to know the disability, hands down. You got to know it by heart, because that's the reason your child is in special ed in the first place. If we don't know that, then why they even in special ed? So number 1, you got to know the reason. Number 2, you have to know when the psychological evaluation took place, when the IEP took place, because a child with an IEP must be reevaluated every 3 years. Every 3 years. So you got to know when the evaluation was, so you know when the next evaluation is due. Now, if the child has an intellectual disability, they get reevaluated every 2 years. So it's every 2 years if they have an intellectual disability. It's every 3 years for every other disability. Okay? So you should know the disability, the psychological evaluation, when the next one is due. IEP is every year. And you should know the date of the IEP, because you know by that date next year, there should be a new IEP. You should know the placement or the level of service your child gets for special ed, whether they are pull out, whether they are resource, whether they are part-time special ed, full-time. You got to know how much special ed they're getting, because the law says they shouldn't get any more than what they need in order to learn. It's a concept known as least restrictive environment. Least restrictive environment. That's the concept. And so, we really need to know, okay, how much service your child is getting, because too much will kill it. Just like too much medication, can hurt you. Too much special ed, and you won't even learn because you're not spending enough time with the regular education children. And the 5th thing you should know is your child's academic skill levels. Like, where is your son academically? And to that point, I want you to look at that evaluation. What is his reading and math skills? Like, what is the grade level you see there on the evaluation for testing? It might be on the last page. It might be on the last page, but even if it's not the last page, it's in the report. Flip to the back and see if you see some test scores. You should see some, Woodcock-Johnson test of academic achievement, Wechsler individual achievement tests. You should see something there.
Okay.
Some test scores. And look for reading, look for comprehension, look for math. I'm trying to see exactly where is he.
Okay, I do see I'm looking at one page. It does say ESC support level, and then across from it say ESC matrix.
Okay, are you on the evaluation? We're not looking at the IEP. We're looking at the evaluation.
Okay, the evaluation. I think this is the evaluation, because that's not the evaluation. They gave me so much paperwork. What I do see right here is just it's the final IEP, but the evaluation is probably on my email somewhere. I can't find it. Let me see. It's another one. They gave me so much. I don't even know which one it is, honestly, Dr. Umar.
Okay. So look at the IEP. You might still see the grade level there. There might be a section. It might say present levels of academic achievement, present levels of academic performance.
Okay, I see it. It say present levels of performance.
Mm-hmm.
And then it says, let me see. So when I look on that form that say present levels of performance, what am I?
You're looking for grade levels. It might say he's currently on a 4th grade level for reading, 3rd grade level for math, 8th grade level. You're looking for grade levels with skills, reading, math. And if you flip through the IEP, there's a goal page for every skill that the special ed teacher is supposed to be working with him on. So if you flip, you might see a reading goal page. They might say, you know, he will be able to do X, Y, and Z by the end of the year.
Oh, okay. Well, what I also, okay, I think I know what you're talking about. But what I also do see is like comment. Like for instance, it's saying describe his strengths and abilities in transition areas. And it said based on teacher input, he is easily distractive, inattentive.
No. We don't want teacher input. We want the testing that was done by the school psychologist or the evaluation team. We're looking for names of tests. It should clearly say, like, you know, reading standard. This should be the name of a test, like Wechsler Individual Achievement Test, and it'll say reading standard score, percentile rank, grade level, almost like a chart, almost like a graph. The IEP wouldn't have the chart in the graph. The evaluation would have the chart in the graph. Was he tested? Did you sign a permission to evaluate form? Was he tested by a school psychologist?
Yes, he was.
Okay, he was. So there's a psychological eval, but you saying you don't have that in front of you.
No.
Okay, here's what I think. Here's what I think you should do for your son. I think you need to find the psych eval. And if it's, and I'm assuming you have it digitally, right?
Yes.
You need to find the psych eval, and you have the IEP, and you need to email that stuff to me. And I charge a $75 consultation fee, and we can just go over everything on the telephone together.
Okay, that works.
So once you find that stuff, text me for my email address, and we can go over it together.
Okay.
Because, you know, we really got to see where he's at. And the reason we need to know where he's at is if he's significantly low, that just feeds your argument again for compensatory education. Okay. And the other thing I need you to understand is special education doesn't end until age 21 or high school graduation, whichever occurs first. So if you don't feel he's academically functional, you shouldn't let them graduate him. You know, you may need to tell them you're not giving my son a diploma because you're not done, you know, and of course, he's not going to want to come back to school. But, you know, his special education could be given at home, or maybe he will meet at the library, or maybe he will come into school after school and get his special ed support. But if your son is not academically functional, and we'll find that out once I look at the psychological evaluation, if he's not academically functional, I wouldn't let them graduate my son. Just keep in mind that special ed doesn't end until age 21 or high school graduation. And if he's not academically functional, and of course, I don't know where he is, but if he's not academically functional, I wouldn't let them graduate my son.
Right.
Because they might be graduating them into the school to prison pipeline.
That's what I was thinking too. But see, the thing is with the school system, and that's what I was kind of mentioning a little bit earlier, they will continue, at least down here, what I think I've heard it in Detroit as well. They will just keep passing the child until they get into the 12th grade, and then they will fail them. Yeah,
but that's where we have to step in and stop it, though. That's where we're supposed to step in and stop it. And I'm not faulting you for this at all, good sister. This is why we suffer so much, because we do not operate as community. The black, you know, our people, we do not operate as community. We call our neighborhoods communities, but they're not. Communities mean common unity. The parents should be organized. There should be black men involved in this situation. First of all, black men should be involved. Black men should be in charge of the boys, period. We should be in charge. You shouldn't even be dealing with this. This should be a man, you know, if not his father, someone else from the community who case manages your son. You know, that's what really should be going on. So I don't even fault you as a mother. There's black men where you live should be taking this over. But we're so damn selfish, and all we want to do is chase white girls and chase money and chase status and chase materialism. I'm very disappointed in what a lot of black men are doing. It's not everybody, but it's definitely too many of us who are involved in everything but we should be involved in. Now, the other thing I'm going to say to you, you know, with the ADHD diagnosis, even if it's outdated, you could have just got your son a 504 plan. A 504 is an accommodation plan that says my son doesn't need academic support. He just needs, you know, a functional support, meaning when you get a 504 plan, you get extra time to take your tests. extra breaks from class. You can get a one-to-one aid, a behavior plan, any kind of support your son would need in school. But if he needs academic support, that has to be an IEP. The 504 doesn't give you academic support. Now, you could get tutoring with a 504, but you can get tutoring with, with Title I money, which is funds that go to disadvantaged schools. You could get tutoring that way, but a 504 may have been sufficient. But if I'm hearing you're telling me he's not where he's supposed to be academically. Is that correct?
That's correct.
Yeah, then that would probably need to be a IEP, because IEP is for learning modifications. A 504 is only for environmental supports, so the child can function in school. Yeah, see if you can find that psych eval. You have my number. Text me when you're ready. I'll send you my email address. You can make the payment, and we can go over this thing together by phone and come up with what the plan should be. But without that paperwork, without seeing specifically what they said in that eval, it's hard for me to point you. Now let's go to your daughter in the 5th grade.
Right.
She was just diagnosed with ADHD. I doubt it.
504.
Okay, she has a 504.
Right.
And the 504 was just implemented?
Yes.
So that means that they determined she didn't have a disability then?
It just say disability. The ADHD is considered a disability.
No. Hear what I'm saying. Hear what I'm saying. If she has a 504 and she does not have an IEP, correct?
Correct.
Okay. So if you have a 504 and you do not have an IEP, that means the evaluation determined that you are not a child with a disability who needs special ed support. You may have a disability, but you have not been found in need of specially designed instruction, or what we call special ed. You follow me?
I follow you.
So they did not discount the ADHD, because we don't diagnose ADHD in school, right? So they didn't discount that. They're simply saying the ADHD is not affecting your daughter's learning. In other words, she can continue to learn in the regular classroom. You feel me?
Yeah.
She can continue to learn in a regular class. The 504 is simply going to give her supports so she can function in school. It has nothing to do with her learning, because she doesn't have an IEP. So they're saying she can learn like every other child. She don't need no special help. Do you feel me?
I feel you.
Now with the 504 though, she'll get extra time to take her tests. She could take her tests in a different place. She may be given extra time to complete her assignments. She might be given regular breaks from the classroom. She might be given a one-to-one aid. She may be given a behavior plan. All of these are supports. But if you notice, I didn't say that they were going to change her reading instruction. They're not going to change her language instruction. They're not going to change her comprehension instruction, her math instruction. Everything stays the same. Do you feel me?
I understand, yes.
Okay, so she got the 504. So I'm assuming you also agree, and I agree, because she don't need no damn special ed, but you also agree that she can do the work, correct?
Yes.
So why did you get her tested for ADHD outside of school in the first place?
I got her tested because I was seeing patterns in every teacher. And mind you, me and her dad, we are on top of her at home. But when she's in school, she's struggling. The teachers are saying the same thing, that she's just distracted. She's not focused. It's just the same behavior as her brother, even when he was in elementary and going up into the school system. It's the same type of classroom behavior, and they're saying that they're not bad children, because they know what bad children are. They just struggling in an area. So then that's why I said, well, let me get them tested so that I can get them some type of help, because the school system will not help your children unless they evaluate your children, unfortunately. So that's the only reason why I got both of them tested.
Okay, we got to slow down with the testing. I understand, because of the propaganda coming from the miseducation system, that black parents think testing helps. It don't. Black parents think labels help. They don't. Black parents think special ed help. It rarely does. Unless a kid is seriously autistic, has a serious intellectual disability, they deaf or blind, has a brain injury or orthopedic impairment. If they have something that is real and obvious, if it's not a real and obvious problem, then it's best to stay away from the testing. ADHD, I'm never going to support that evaluation. Conduct disorder, I'm never supporting that. Oppositional defiant disorder, I'm never supporting that. Emotional disturbance, I'm never supporting that. And for children, you know, young children, your daughter's in the 5th, so she's not as young as some of these other children who be getting evaluated. But we really have to stop with all this testing and evals. What they need is focus. What they need is discipline. What they need is more practice. Our children are not practicing enough at home. And then when they don't get the skills, we say, well, maybe they got a learning disability. No, they need practice. And we're not making them practice at home. You see, and we just run into special ed. That's not helping our community at all, because they're turning black children into a permanent underclass through us, because we keep running to the school looking for tests. Special ed does nothing to help our children. Very few black children will be helped through special ed. We have to stop running to the school looking for tests and diagnoses and evaluations and IEPs. It does not help. All they need is practice and tutoring. Now, let me ask you, because you mentioned ADHD for both. For me, ADHD stands for ain't no daddy at home disorder. Ain't no daddy at home disorder. Where's the biological father for your children?
Well, my daughter, well, I'm married, so my husband is, you know, he's in both with my son.
Okay,
and
he's not the biological father, correct?
He's not the biological for the first.
Okay, where's the biological father? He's not the biological for either kid, correct?
No. My husband's the biological for my daughter.
Okay, he's the biological for your youngest, not the oldest.
Not the oldest, correct.
Okay. Okay. Because if the father is there and she got diagnosed with ADHD, I'm not sure if he's emotionally present. So you got to realize, when children don't get their needs met at home, they go to school looking for their needs to get met. That's where the attention comes from. That's where the so-called attention deficit comes from. They need attention. And if they're not getting it at home, they're going to go to school and look for it. So that's one thing you got to look at. You know, number two, you have to look at diet, artificial diet at home disorder. You know, we got to look at diet. It's normally attention on more than diet. It's normally attention more than diet. And then you have to look at lack of discipline at home, structure, accountability, punishment, consequences when they don't do what they're supposed to do. If there's no discipline structure in the home, they're not going to achieve in school. And then the last thing you got to look at is whether or not there's home life dysfunction. Okay, attachment disruption due to home life dysfunction. Kids go to school and they are inattentive and hyper because emotionally they have issues going on as a result of what's going on at home. Mom and dad fighting, child abuse, emotional abuse, parental abandonment, alienation, sibling rivalry. It could be a whole host of things. So you want to rule out all that other stuff before we start looking, you know, at the so-called ADHD that's in the white man textbook. Now, are either of your children on medication?
They were prescribed medication, but it's, you know, they don't consistently take it. But
what did they give them?
They gave what is this? Well, they gave my daughter Concerta, and then they gave my son Vibrant, something like that. I think it's Vyvanse, but he was on Concerta at first, but he wasn't. He was saying it didn't do anything. Like, he wasn't feeling any type of way, just nothing.
Okay. Well, side effects for Concerta: sweating, increased blood pressure, mood changes, anxiety, nervous, irritability, trouble sleeping, fast heart rate, pounding heartbeat, fluttering in your chest, loss of appetite, weight loss, dry mouth, nausea, vomiting, stomach pain, indigestion. And these are just some of the side effects for Concerta. Okay, your daughter is a prepubescent girl. These medications could mess with her normal prepubescent development. Okay, her body is about to go through the process of turning her from a girl into a woman. And with her taking those drugs, there's a concern that something could go wrong as a result of these chemicals that are being introduced into her body. Remember, your brain regulates, okay, your entire metabolic state. Your brain regulates your growth, your hormone release. Okay, everything is regulated by the brain. These drugs attack the brain, you know, so just keep that in mind. Now, when you look at Vyvanse, You got nausea, vomiting, constipation, stomach pain, abdominal pain, loss of appetite, dry mouth, headache, nervousness, dizziness, trouble sleeping, sweating, weight loss, irritability, restlessness, and the list goes on. So be careful with those medications. Please be careful with those medications, good sister. But with that being said, you got my number. Text me for my email address. Get me that paperwork and pay the consultation fee, and we can go over this thing in detail and see what your next step should be.
Okay, I'll do that. Thank you so much, Dr. Umar.
No problem, Queen. Be blessed.
All right.
All right now.